sorry, on the, yeah, our Facebook page. We are live there. Please, guys, let us know. Thank you very much. Let me double check this. My side here. It's the two ways. Okay, guys, just now, I believe, or maybe, I'm not quite sure. Now, it should be live right now on Facebook. Please, guys, if I'm alive and you can hear me there, please, guys, let me know. Okay. I'm very excited today for this mock discussion. I have seen your result and I'm very, guys, very proud of you. I have seen some of you scored above 90, above 80, the most between 60, 70 in the beginning. That's very normal. My side here. Okay. I believe I see some of you. Let me just now, guys, share the screen. I think that should be on. It's much better to be here. There's live, yes. On. Be going to here. Here. Okay. Stuff, yes. Yes. This Facebook every time does something weird. Okay. Sorry. Okay. Share the screen first. Guys, can you see my screen right now? Okay. Let me check your answer here. Okay, guys, I believe it's good time to start right now. Hi, Dr. Tanvir. Hi, Dr. Kadam. Hi, Dr. Hash. Wow, 60, not bad at all, Dr. Tanvir. Hi, Dr. Veer. You get my... Guys, what you can see, because I only see, I know my, I think stopped somehow. Maybe what I will do is, I will stop sharing and I will share again. Stop sharing. Yes, please. That is much better. And then let's share again. Actually, let me check this first. Yep, works fine. And Facebook seems like it should be work fine too. Let's share now. Okay, I hope things fine right now. Yes, yes, it's fine from my side. Guys, please, guys, if you can see the Facebook Live, that will be great then. Okay, guys, I believe it's good time to start right now. And to start, I would love to check on every one of you. And by the way, by myself, I'm very excited about this first mock. By the way, guys, this is the first mock for March 2026 champions. Hi, Dr. Tanvir, how you going? Hi, Dr. Samiha, how you going? Good evening, Dr. Rido. How are you doing? I'm doing great, thanks very much. I hope same to you as well. Hi, Dr. Callum, how you going? Dr. Chuval, how you going? And everyone. Seems like my... I pause for a second. Hi, Dr. Leo, how you going? Dr. Cash, Dr. Fatima, Dr. Walija, Dr. Alam, Dr. Simran, Dr. No, Dr. Kushkan, Dr. Sanjita. No problem. That is great then. I hope you can hear me, guys, now. Hi, Dr. Sajriti, Dr. Eshika, Dr. Daniel. Thank you, Dr. Daniel, Dr. Alifia. I'm alive, yes, because I'm talking now, so I'm alive, right? Dr. Daniel, Dr. Kelvenda, Dr. Veer, Dr. Fatima. Sir, literally for a week I studied TG harder because of you motivational first. I am hoping you keep taking such mocks on weekly basis to push us hard. Yes, and this is what we can discuss right now. Do you know, guys, which task we are on right now? Guys, which task we are on right now? I'm trying to do my best to help every one of you guys. Now it's your turn. It's your turn. It's up to you. You can be with these amazing champions. The champions are really taking the journey seriously, like Dr. Tanvir. right? And then try to find time for yourself at least 2, 3 hours every day to finish TG because only 1 week left. 1 week, I would say, 10 days left to finish all TG. Right? Do you know, guys, which task we're on right now? So I will read them this message again from Dr. Tanvir. Say literally, 4 week I start TG harder because if you motivation first, I am hoping you keep taking such mocks on a weekly basis to push us hard and check our knowledge comment. That is good way. And this is the plan, by the way. Hi, Dr. Shiva. How are you going, Dr. Lakshmi? Hi, Dr. Begnesh. Hi, Dr. Teresa. No problem at all. Hi, Dr. Simran. Okay, that's a very good one from Dr. Simran. I know, guys, most of you actually think the same way, like Dr. Simran, right? You think the same. Answering question wasn't hard, but I scored low in the exam. Dr. Simran, and this is the benefit of the mock exams. The benefit is if you study TG only and then start to answer question, you may think you answer the right way, but on the other hand, it's not. That's why we do the mock exam. So every one of you guys will be able to apply whatever they read from books into the questions. And this happened in exam. And that's why there are few people actually, after they finish the exam, they think that they did well, but they couldn't pass. And we are here to teach you these tricks and how exam, not just only information knowledge, exam beyond than this. I love this part, Dr. Simran, from you. Hi, Dr. Teresa again, Dr. Simran, Dr. Temple. Second, thank you, Dr. Temple, very much. You're very smart. Yes, guys, today we just started second TG task from Wednesday. From Wednesday, yes, from Wednesday. And we will finish second TG task on this Wednesday because we take a week time. Guys, am I clear about this? Am I clear that we are at this stage on the second TG task? Do you know, guys, from which page to which page? Maybe someone has joined us just only right now, may ask question. From which page to which page in second TG task? And by the way, the mock exam, the next mock exam will be from the second TG tasks. In this way, it means I have done my part. I'm trying to help you as much as I can. As much as I can. To make you study all TG in only 3 weeks' time, not just study TG, but you learn how to answer the exam in the right way. And not just this. That's make some of you here will be amazing once they get closer to the exam. And that's a benefit. If you start from right now, you will be amazing the more you get closer to the exam. But if you take your journey lightly at this stage, you may find it really hard. I don't want anyone to be under stress. I started early, especially the course, because I don't want any one of you to be under pressure. We need to finish all the things as soon as we can. So please, guys, take it seriously. So you write, Dr. Dempo, it's actually second TG task. You write, Dr. Leyu, you write, Dr. Shiva, you write, Dr. Simran, Dr. Fatima. I love, guys, this. I love how you know exactly what we're going on. Dr. Vekcha and Dr. Echika, Dr. Walija as well. Very good. Thanks, Dr. Kushka. Hi, Dr. Fiz, how you going? English, yes, English is very important, Dr. Zisha. No, Dr. Hash, we already finished TG1, but the mock today, the mock discussion and mock answer today is about TG1, but the new task is TG2. Wow, lovely. Hi, Dr. N, how are you going? Dr. Elias, how are you going? Welcome, Dr. Zishan. Welcome. Yes, Dr. N, you're right. Yes, yes, guys. Yes, yes, yes. Fantastic. Thank you. Please, guys, look at Dr. Teresa and Dr. Hash, right? They mentioned TG from 80. Guys, who's right? Dr. Teresa or Dr. Hash? I believe Dr. Teresa, 80 to 80. I think Dr. Hash, like, you know what? Let's just cheat on them, cheat on Dr. Adam, just to make the mock exam from 80 to 100, 224 only. If I say 80 to 180, 80 will make the mock exam from more pages. Let's just make him to make it only from few pages, right, Dr. Ash? I'm just kidding, Dr. Ash. Yes, guys, it's from 80 to 188. Yes, Dr. Puana, it's a. Dr. Pavana, yes, it's a. Please refresh your drive, you will find it there, please. Dr. Simran asked question, Dr. Bidu, do we have any strategy to shortlist appropriate answer and rule others? Sense wise, yes, easy. This stuff will be very easy. I will tell you about all this stuff. That's really very good question. Yes, this is all about. Do you have your own pen and paper, Dr. Simran? Just only get the pen and paper and then write down all the discussion we're going to do right now. And by time, you will be nicely built up. Lots of good concepts will help you to choose the right answer. No problem, Dr. Hash. I know, that's okay. Yes, you're right. From it. So guys, everyone attending the mock right now, everyone doing March 2026 or September 2026, you should now study from page number 79 or 80 to page number 188 from TG book, because the next mock will be from these pages. I hope things are clear. Thank you very much, Dr. Tanvir, for your suggestion. That's okay. We're going to make a poll after some times, and then definitely I will put Saturday there. And then once everyone has chosen Saturday, we'll be happy for it. That's great. Yes, the page number from 80 to 188, please. Okay, guys. Are you ready to enjoy? Guys, you ready to enjoy? I want to really feel, I want to really put myself in your position right now. How I feel, guys, about the mock? How I feel about going through the mock right now? Do you feel happy that we're going to discuss the mock? Or do you feel stress? Or do you feel, you know what, I don't want to do anything. I just want to let the journey end and that's it. Which one? For me, I'm very happy. Always when I been between you guys, I feel very happy. When I answer this type of questions, talk about dentistry, feel like I'm helping you, I feel very happy. I'm very excited. Yes, Dr. Fatima, happy? Very good. I'm happy with this. Dr. Walija, I'm happy with this. Dr. Fatima, are you stressed? Why stressed? Happy? Dr. Hash, definitely. You shouldn't be stressed. One of the things right now you must learn, whatever happen in your life, especially to pass the exam, you shouldn't be stressed at all. Frustrated? That's okay, Dr. Ashika. You may be frustrated today, but you will learn a lot. And next time, you will not be frustrated. You will be happy. But again, pen and paper and write down everything. Stressed? Why, Dr. Mohib? You shouldn't be stressed. Let's enjoy. Yes, Dr. Shiva. I'm very happy. Happy to learn from you, Doctor. Thank you, Dr. Sanjay, saying this. I'm very happy to teach you as well and discuss with you. Thanks. Okay, let's start. Dr. Samiha mentioned, excited to learn about new concepts, Dr. Pido. I love to hear this. You know what, for me, more important than the mock discussion is what you feel, guys. More important than the mock answers is to know how was the mock with you? Did you find a good mock for you? Do you want me to change something in it? Your feedback, it does make a big things for me. Dr. Ray is happy too. Wow. I'm happy too, Dr. Leah. I hope our team as well happy. I'm not quite sure about the rest of the team. Yes, Dr. Valencia, that's exactly what we do. You're right. That's why once we discuss the mock, you will understand exactly. Yes. To improve. I'm not looking for your shortcomings. I'm looking that you improve. You get improved. Excited to learn about new concepts of torpedo. Same here. Okay, let's guys read Dr. Teresa comments because I believe Dr. Teresa does not only represent herself. Dr. Teresa mostly represent everyone else, or at least 80% of the champions here. Not everyone wants to write like Dr. Teresa, but she is brave and she wrote stuff. And this message, it can be a message for everyone to you. Doctor, I am doing the best I can, but I cannot finish the whole task as I have full-time job. When we start the next phase of studying the crash course, will we have more time? Definitely you will have more time, but you will have better experience, Dr. Tracy. Because so far, if you finished about 50% of the task, you only left with 50%, and you can do it in the next task, right? And explain to you why I'm giving you this stuff, and I give you different options. If you really cannot study TG and other stuff, at least ensure you did the Bidu Bytes, which is, I believe, Bidu Bytes, it has everything in it. It has everything. The cakes, Bidu Bytes, diamonds, it has the important concept. It has topics from TG, topics from Odell, topics from Dr. Cameron, topics from Dr. Paul Apples, topics from Surrender Journal for all the good resources. And Bidu Bytes, I think, can be finished only in 1 day, believe me. So at least, if you do Bidu Bytes, I'm happy. At this stage, at least. Love attending your session. Believe me, Dr. Muhib. I love to see you, and I love to see all of you champions. Because I know how much you love the session. That's why I love everyone to attend, to see you and help you guys as much as I can. Mock was interesting, easy, but confusing. Exam will be the same, Dr. Sajreti. Saj, I will call you from now Dr. Sajreti. Saj, it's easy for me, so I will call you from now on Dr. Saj, if you don't mind. Exam will be the same, Dr. Saj. I'm trying to replicate the exam as much as I can. Mock was interested. I'm happy to hear this. Easy, but confusing. That is the way. When I saw the score, I understood the options were actually confusing than easy. As all options looked like that one was the correct one. I agree. And in exam, we're feeling the same. This is a strategy of MCQs, because MCQs, you're going to choose the best option, not the right option, not the correct option, the best option. So all of them can be correct, but one is the best. It was in depth. I'm very happy to hear this.
Dr. Adam?
Dr. Snobia, I'm very happy to be here too. and I'm very happy that you are here. Thank you, Doctor.
Hello, Dr. Adam. Can I say something to your
My
class?
exam wasn't up to the mark, Dr. Pito. My progress was not good. Be patient, Dr. Faith. I believe if you're going to progress every day 1% only, that will be amazing improvement. But I don't want you to go back. Improvement, and by the way, improvement never be up only. Improvement, it's somehow like gold. You see, guys, gold? Have you seen the gold chart? Look at the gold chart. Gold chart, it can be up and down, up and down, up and down. But overall, it's good progress and improvement. Never give up on yourself. Never give up on gold. Never give up on yourself because you are a gold. Dr. I have started with TG2, but I still haven't completed topics from TG1. That's okay. The question here is, Dr. Fatima, did you do your best, Dr. Fatima? Yes, doctor, I did my best. I'm mom, I have kids, for example, right? I work, I'm just wherever. I only could study 2-3 hours. Did you study this 2-3 hours? Yes, doctor, that's it. Don't be confused, don't be stressed.
Dr. Adam, this is
Yes,
Dr.
Dr.
Leah.
Tanvir, that's exactly what I was saying to Dr. Fatima. Dr. Tanvir, sir, I am also doing 2 jobs full time in a week, but I try push myself. You imagine, Dr. Tanvir, my limits to best as possible as you encourage and motivated us. You truly my inspiration by that study. Believe me, Dr. Tanvir, every one of you here is my motivation. I'm here for you guys. While solving mock, I was struggling as most options were confusing. Dr. Alifea, once we start discussion the mock right now, the mock discussion, you will find out that it's not confusing anymore. But the most important thing is you write down the concepts we're going to discuss today because we just in the early stage, we started too early, right? Write down because tomorrow it will help you to understand better. I was sad. No, why should be sad? We learn. You never be sad. It's an experience. You should be happy because you have better experience. Think about it. There is one candidate somewhere. His name is Candidate X. Candidate X is staying somewhere, not attending the mock, not attending the discussion. Didn't even try to do TG. Who's better, you or Candidate X? Definitely you. You got experience, even if you couldn't answer right at this stage. That's okay. Study only not enough. Exam is a system. Study is must, but not enough. Please, guys, write down this. Study is must, but not enough. Guys, am I clear about this? Study is must, but not alone. Let's make it this way. Alone, not enough. There is critical thinking, and that's what I discussed today. I can tell that I improved. I love to hear this. Answering compared to the first time. I answered the 3 more questions last month. I love to hear this official. You know what? I will give you a big heart. Look at this. This is my heart for you. There's a spirit should be. Because by saying this, you convince yourself you did very well. You encourage yourself tomorrow. Instead, you study 2 hours, you will study 3 hours, and after tomorrow will be 4 hours. Thank you, Dr. Faith. That's a reality, by the way. We need this. We need to study better tomorrow and after tomorrow. We shouldn't stop. We should work hard. Thank you, Dr. Faith. Thank you, Dr. Bido, for your motivation. Thank you, Dr. Faith. Dr. Leo from nowhere, she's laughing. I don't know why. From nowhere. Why are you laughing, Dr. Leo? People talking seriously right now. Why you laugh? Yes, Dr. Fatim, I believe in this. No problem, Dr. Arifai. Okay, now. Thank you, Dr. Saji. Okay, I love Saji now. Seems like you are Aussie, right? You Australian? Because that's what we call, that's we shorten the stuff. For example, Prespin, we call it Brazy. So now, your name is Saji, like Brazy? Okay, no problem. Okay, guys, now let's start. Everyone on Zoom. I see you guys, you are in Zoom. We have 61 person in Zoom. We're shifting now from Zoom toward Facebook. Everyone in Zoom, right? You can join us on the Facebook. So you actually can communicate with us. Okay, I'm excited. I'm happy. Let's start. By the way, guys, our session is on Monday. Tomorrow? No, after tomorrow. Our private session, Monday. Now, let's start the first scenario. A 29-year-old new patient. New patient. Comes to your clinic after falling onto his face. Face is a keyword here for the instance. Complain of moderate pain and a fractured upfront teeth. Okay. We're not sure how much a fracture. Guys, how big was the fracture in this case? Do you know? Do you really know? How big was the fracture? Let's see, this is one of the most important concepts. No? Dr. Dembo said no. Okay. Dr. Envy mentioned uncomplicated. That's okay. Dr. Calvenda say no. That's okay. Let me tell you. One, write down the space, guys. One of the most important concepts in exam is a surprise to look at the photo. That is a big surprise. Really? Is it really important? Yes, important. Can I know how big was the fracture? Yes, from where? From the photo. Look at now the photo. Do you think really from the photo, if these teeth are broken, do you think the broken part or the broken teeth are complicated or uncomplicated? Thank you. Crown fracture. Dr. Tanvir, it's very good. Mention uncomplicated fracture. Uncomplicated crown fracture. Thank you very much. So now, how important now if I ask you next time, I'm asking you the question for this scenario or any other scenario. Can you tell how big is a fractured part? And there's photo provided. Will be able to tell or no? Yes, you should. So how important is photographs? Very important. Yes, Dr. Yes, Dr. Fatima. Yes, Dr. Calvenda. Right? Great. So now we're talking about a new patient. He got a trauma to his face. The upper front is being fractured and it is not complicated fracture. He looks anxious, definitely after trauma, holding his face. Medical history, diabetes, asthma. And by the way, he's on salbutamol inhaler. He has prostatic heart valve and gastritis. Every one of this information, it may help you to decide on something. This is your first interaction with him, with his new patient. What do you think the right answer here, guys? Is it A, B, C, or D, or E? Okay, we're just waiting for your answers. Now he's a new patient. Does he know your name? No, he doesn't know your name. So do you think will be better to tell the patient about your name or not? Yes. And by the way, your name is something really very important to tell the patient about. So you can call each others. Now, first option has a name in it, which is fantastic, as you see right now. Second option has a name. All of them has a name. So now, so far, all the options correct. First option, good morning. I am Dr. This. Please come in and take seat so we can get started. That's okay. This one can be correct. But which one is better? Put yourself in a patient position. Let's see your answer first. Let's check your answer. Your answer is A alpha, D delta, A alpha, B bravo, B bravo. It's the confusion here. A alpha, it seems like, guys, you have confusion. Ah, Dr. Leo, always B. You see, you're lucky today. You have the lucky letter for you, Dr. Leo. Dr. Walija A, Dr. John. Okay, guys, seems like there's a big confusion about this question. I will take my time on it then. B, 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 C, B. Okay. Now, A option can be right. Yes, you can tell the patient good morning. I am Dr. Adam. Please come in and take a seat. Guys, who has answered A alpha? Dr. Walija answered A alpha. Dr. Jana answered A alpha. Now, Dr. Walija and Dr. Jana, you are a patient right now, and I'm your dentist. Tell me which one sounds more, it has more empathy in it. Feels like this dentist really will help you the most today. We really care about you. Which option? There is a care part in it. Option A, this is a dental chair. And then you are here. And dentist here. Patient is sad. Dentist is sad because he's going to take money. Patient sad because he has trauma and will pay money as well. This is going to take money. Right? Now, you tell the patient, good morning. Please come in. Have a seat. Sit down here. Is this going to be good for you, or to tell the patient, good morning, I am Dr. Adam. You dentist today. Ah, okay, you are a dentist, dental. You know the practice manager, right? Yeah, because I have seen someone outside. I didn't know. Someone hasn't introduced themselves to me. So you are the dentist. You are the one going to look after me. Yes, I am. So you know dental assistant? No. And now look at this. Can I confirm your full name and date of birth? There's another option. Before you tell him to have a seat. Hi. Do you like the word hi? No, that's wrong. Because you must be professional. We love to say good morning. Hello, we don't like it. In clinic, we like good morning. It can work. Hi can work. Hello can work, but we need to choose the best option. Hi gone option. Hello gone. Hi there. No respect at all. No respect. So now the only two options may sound okay for me is the first and the second. Now, Which one do you believe it's more good for you? The first or second? The second one, it has better things than the first one. Why? The second one has good morning. It has good morning like the first one. Your name are equal so far. Now, your dentist today, it means you introduce yourself. That's called introduction. You must introduce yourself first because they want to know who you are. And then, can I confirm full name and date of birth? People live in Australia. If you live in Australia, you will understand if you go to your GP or any health profession, the first things they ask you this way, can I confirm your full name and date of birth? Why this? It's some sort of safety. In Australia, you must be safe dentist. The first important thing is to be safe dentist. Guys, I hope now B Bravo, it's clear option for you. That's B is much better. To repeat this again, A alpha is good, but doesn't have safety. It doesn't have introduction. It's very straightforward. Have a seat. No good. B is the best. C, we don't like it because high. D, we don't like it because hello. It's not professional. E, we don't like it because high again, especially high there. I hope I'm clear about this option. Next. Which medical history question is the most important to ask first in this situation? Look at the keyword. Ask first. Again, who's this, guys? Hand downs, legs downs, legs always down. Otherwise, you may hang the patient on the ceiling. In this case, the legs will be up. I don't need to do this. Patient is sad, crying, then to the chair. Dance is happy. I don't know why small head today. That's all the patient seems like. Hands up because it's gonna take money and do work. Now, the question asked about what is the most important medical history to ask first? The keyword is first. Let me check your answers, please, guys. A alpha, good. A alpha, fantastic. I love this. A alpha. Ooh, you did very good in this question. I love it. Not that much confusion? Perfect. I love this. The answer is A alpha. Why? Because that's the first thing. Do you have your asthma inhaler with you today? Why? Because at any stage, once, let's imagine you tell the patient, right? Let's imagine you tell the patient this way, good morning. Just good morning. He start to cough like, oh, 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 The patient will say, oh, and you say, ah. Now, you ask yourself, why did I not ask the patient about the asthma inhaler? Now I need it. Doctor, but you know a prostatic heart valve is important. Only important if you're going to do invasive procedure. Not now. When you decide about invasive procedure. Not now. The question asked about first. HbA1c, not important as well, because not that much, it's important. It may come after inhaler. In order, I will go with option A. Then option C, very important because I need to know if he's well or not to stay on the chair and I start asking questions. And then maybe B, and then D. Order and sequence something very important. You must understand why A is the most important, because the patient if they talk, they may get asthma. A is the best, guys. I hope now it's clear. Let me check if you have any question for me. Guys, please, if you have any question, please ask. I'm very happy to take all your questions. I'm very happy that you're very good, Dr. Tanvi. Thank you, Dr. Saifa. Big heart for you. Because you did very good. You're right, Dr. Dempo. Because if we do any treatment, he can have attack. Even believe me, Dr. Dempo. It has happened in the clinic many times. If you just say hi to him and then they start to cough, hi, doctor, and stuff, you cannot control it. Very good, guys. Seems like you did very good. A is the right answer. Next question. What type of questions will you ask about his pain? A, B, C, D, and E. Which one? I give you a small hint. You should ask only open-ended question. Open-ended question means something you will make the patient to feel comfy, to talk more about his pain. Which option, guys? Is it A or B or C or D? Let me check your answer. A, perfect. Guys, you're doing very good. E, I will check E for you, Dr. Kelvenda. Dr. B, even for examination, do we have to ask the patient to come next time if he doesn't have inhaler with him? What be the right way? Yes, maybe, doctor. Look, if the patient doesn't have inhaler, you may send someone to get the inhaler. It's better to send someone to get the inhaler. Especially trauma case means mostly has happened around his home. A, open-ended question. Perfect, Dr. Simran. Dr. E, Dr. Teresa. Okay, so now the confusion between A and E seems like, okay. A, E, okay. A, open-ended question. Perfect, guys. Let's discuss E echo. E, can you rate your pain on a scale 1 to 10? Definitely that's correct option. Who said this is not correct? Definitely. This is one of the questions we ask about pain. We have some technique, we call it Socrates, like this way. Socrates, right? About the pain and stuff. Definitely don't need to ask every time all this question about Socrates, right? And one of them is the intensity of the pain, how intense in it, how severe is the pain, severity of pain. But in the first instance, we love the patient to talk by themselves because maybe the patient's concern, not severity. Why should I guide to severity? Maybe the patient is pain on biting. The patient want to eat. Patient want to tell you. For example, let's say you and your husband or you and your boyfriend or your partner? Which one is better? Your partner asks you this type of questions, like, you are cry because of this, or you are upset because of this, or much better to make you to elaborate more, like tell me what things can make you happy, or they tells you something, I will buy for you food to make you happy. Is that better, or to ask you what things can make you happy? Or she asks you what things can make you happy? Is this better, or she just only come and telling you, I will make food to make you happy? No, food will not make you happy now. Exactly like severity. Patient may not care about severity, maybe care about pain on biting. Tells you, once you ask the patient, can you describe more about the pain? Yes, doctor. You know what's wrong with the pain? What, doctor? It just comes when I drink cold drink. Ah. When I drink my coffee in the morning, that is really annoying. Not severity, not severity. Also, this question, can you describe more about the pain? If severity is a reason, patient will tell you, doctor, I couldn't sleep last night from the pain. It was horrible pain, doctor. So when you tell the patient, when you ask the patient, can you describe more about the pain? He will take out his concern, the main concern. It can be severity, it can be no sleep. He will put it first for you. It can be B, can be C, can D, can E. Answer, guys, is A alpha. Why? Open-ended question. You give the patient freedom to tell you the main concern, the first annoying concern they want to discuss with you in the beginning. Then, if something missing, you can use closed-ended questions in one of these. Hey, that it should be an easy question with easy answer. Where, which part is more important? Which part you will see in the beginning, even if it's not trauma case? Which part of the patient's body you see first? Once you come to your clinic, where about you gonna look at? Are you going to look at the patient's shoes, the patient's legs, the patient knees, the patient tummy, or the patient teeth? Do you think the patient teeth? You say, hi, I'm Dr. Adam, the dentist who's treating you today. Can you confirm this and this? Once you tell the patient this way, what exactly are you going to check first? Which part? A alpha face, right? Very, very important. In all the cases, in every cases, in any single patients in this world, the first things they come to us, we look at the eyes and the face. After this, because this is the first step of first interaction between you and the patient, the face, because there's eye contact. In this case, you can notice, okay, there is any trauma on the face, any cut, any laceration, any bruise, any swelling. Is it infection? Is it an injury? There is redness, there is puffness. So answer is A alpha face. Should be easy thing for you. Even for trauma, face is very important. Also, another hint for you is he actually fall on his face. I hope now it's clear. Teeth later on. Face first, teeth after face. Gums after teeth. Lips is a part of the face, but face is a general answer. Include lips in it. That's why face first, lips second. If face not existed, I may think about lips. If lips not existent, if face not existent, lips not existent, I may think about teeth. The patient cannot brush his front traumatized teeth. You consider prescribing chlorhexidine. Now chlorhexidine mouth rinse. Which statement is the most accurate regarding intraoral chlorhexidine mouthwash use? Something is the most accurate. Most. You may have some options which are accurate, but I want the most accurate. The most. Let me check your answer. Dr. Fizz, C. Charlie. Dr. Amel, B. Bravo. Dr. Ann, C. Charlie. Dr. Sahifa, B. Bravo. Dr. Fatima, B. Bravo. Dr. Lay, always B. Bravo. Never change. Dr. Niga, B. Bravo. Dr. Demble, A. Not correct. I agree. I'm not sure. Let's check. Dr. Pona, B. Bravo. Dr. Saji, B. Bravo. Dr. Bella, C. Charlie. Dr. Teresa. So now the confusion between B and the C and the A, maybe B and the C. Dr. Fizz, Dr. Valisha, E. Echo. Maybe that's for the B and the C. Okay. Let's check now these two options. Dr. Shiva, C. Dr. Daniel, C. Okay, let's check this right now. Dr. Valija, B, and Dr. Marina, C. A. Chlorhexidine mouthwash should be diluted with warm water before use to reduce staining potential. That's incorrect. Totally incorrect. Wrong. You shouldn't dilute it because it will come mouthwash. We're talking about mouthwash only. Only mouthwash. Chlorhexidine comes with different forms. It may come like a gel. It may come like a cream. It may come like solution. It may come like mouth rinse. I don't care about the stock forms. I only care about mouthwash because the question asks about mouthwash. Now, should I dilute mouthwashes? No, because the mouthwashes has actually a good percentage in it, which is 0.12% to 0.2%, 0.2%, 0.2%. Mouthwashes comes under these two concentrations, either 0.12% or O, you see this big O, dot 2, O.2%, right? Now, should I dilute it? No. Wrong, the first one. Chlorhexidine has antimicrobial, antifungal, and the limited antiviral effects. Perfect option. It's never wrong. Yes, it has antimicrobial effect, antifungal effect, and yes, it has some antiviral effect. Some means limited. So the word limited means some. Perfect. Option B. Option C. Chlorhexidine in 0.12% 2% wrong. You see? Be careful. Tricky. That's why I was saying to you, you may find reading easy to read TG and stuff, but to focus and to answer the right question, it's a system. One of the system is read properly, look at the figures in the right way. If this 2% to be 0.2%, that should be correct. 2% it can be used as chlorhexidine, but as what? Solution, not like 2%, it can be good concentration as solution, but not as mouth rinse, as mouth motion. So option C is wrong. Why? Because it should be 0.2%. Patient should rinse vigorously immediately after brushing to maximize. No, you don't need to do vigorously after. That's too much. Anyway, it can be, but not as correct as B. E. Chlorexidine shouldn't be used for more than 10 days. Oh, someone has answered the E. I remember, be careful, it's not 10 days, it is 15 days. 2 weeks. The answer should be 2 weeks, not 10 days. So now, guys, the right answer should be perfect. If you mention B, bravo now. And by the way, guys, that's okay if you don't really answer correct today. We learn, right? We really learn. Next. Mr. Morrow, a middle-aged man, present with a complaint of dull pain in lower front region. Dull ache, dull pain means mostly periodontal diseases. The pain worsens when biting and has increased over the past few days. Okay, seems like there is a mobility here, right? The discomfort is between teeth 4-1 and 3-1. There's 2 teeth. On examination, you found 4-1 and 3-1 are severely mobile. Let's now use this information to help you in answering the question, one by one. This is the way you need to think, right? Now, if the patient has discomfort or pain, most probably, dull pain, most probably need to prescribe painkiller, most probably. Let's see if we want to use this information. The teeth are severely mobile. Do you think severely mobile will affect the classification, the class, the diagnosis, the stage, the grading, or not? If yes, why do you think so? Smart. Let me know. Stage 4. Very good. Yes. Thank you, Dr. Leo. Thank you, Dr. Veer. Yes, stage 4. It does affect what? Staging, guys. Mobility. It does affect staging. Severe mobile teeth will take you from stage 3 to stage 4. So now from so far, I knew this case stage 4. Now, after you have interviewed the patient and taken an intraoral photograph, what is next step? After this photograph, what's next step? Take an X-ray, perform periodontal probe in-depth measures, explain to the patient about your findings, check mobility gently, do percussion, teeth number 4-1 and 3-1. A, B, C, D, and E. Doctor, all of them correct. What should I choose? I need to take an X-ray. It's important in perio cases. Chart is very important perio cases. To explain my findings, very important perio cases. Check mobility is important. However, you have severe mobility, but yeah, whatever. Gently percussion still somehow can be important. Which one? Critical thinking. Dr. Fatima, hi, Dr. Bido. Can I get a discount and could you explain to me the registration steps? I'm from Kuwait and not currently in Australia. Will this be an obstacle? No, at all, Doctor. No, most of the champions here right now, they are from overseas. I don't think that's an issue at all. Please, admin, if possible, can help please Dr. Fatima. She's asking for help, please. Can I get discounts? I believe so, Doctor. I believe so. You just only talk to the admin, they will help you in this stuff, Dr. Fatima. Now, the answer is Dr. Amil said C or B. Okay, Dr. Amil, we'll discuss this right now. Dr. Eshika, I think it's A alpha. Dr. Mawais, A alpha. Dr. Walisha, can you explain why wasn't E? E because it's not only 10 days. I know you asked about chloroxidine mouthwash. Because it shouldn't be 10 days. It should be 2 weeks. X-ray percussion is not sequence. Okay, it's not sequence, okay. C, B, A. A is good because bone loss. Okay. A or B, very good, B. Now, the confusion between A and B mostly, right? I think X-ray to exclude perio lesion. Okay.
Hello, everyone. Dr. Adam will be joining soon. This is Dr. Leah. Am I audible? Hello, everyone. You're doing great, guys. He will be joining in 1 minute. He just have technical issue. I wanna say that I'm proud of every one of you. You are doing amazing job. And I know it's somehow the first mock for this course. I love the beginning of the things. It always tell me that we can start over again. We can be good again. I noticed that some of you are mainly asking about, will I be good? Like I'm somehow slow in understanding the things and so on. And I want to tell you, you will be good by practicing. Dr. Adam is training you not to be a normal person. He is training you to be the best out there. Because to pass the exam, you need to be the best out there. And you will be this one, okay? You don't need to pressure yourself. We start the course early just for you to give you enough time to practice, to be amazing. So just trust the journey. And I always tell our candidates, you are like the plants. This is the example I have told. I was telling this example for maybe like 2 years, 3 years now. We all like a plant. The plants to be bloom and to grow, they need to have supplements like sun and water, right? And also, they need patience. They will not grow in 1 day. And you will not be the best and you will not be a hero in 1 day. It's a progress and it's a learning curve. You will be good. Doing mistakes is the first step to be amazing. I know it's somehow like, how come doing mistakes can be good? No, doing mistakes will be good, so you will not forget these mistakes in the future. We support you and you will be good. I trust every one of you. Give yourself give yourself the space to learn, and give yourself as well the patience to do mistake and to be slow in the beginning and to learn to be the best in the future. And by the way, I'm Dr. Leah, and I'm mainly for part two. I'm not for part one, but I love to attend the beginning of part one because they always remind me of the beginning of the things. It's just a memories to be, attending part one course, even in the first sessions, the first mock, the first orientation. It's one of the best memories for me. And I hope that I can see every one of you one day in part two with us. We are making a lot of things in part two, a lot of fun. We are waiting for part one result, and we are expecting the result to be soon, by the way. Um, from this Monday, I'm expecting the result. So I wish all our fighters the best. Um, I wish them to pass the exam. I wish you too to pass the exam. Follow up with us in the next days because you will see the amazing fighters. They became champions and they passed the exam. I trust every one of you, and I know you will be good. Let me see let me see the comments if you have any comments to answer. Dr. Daniel is asking me how's the life after ADC. It's amazing. You will have your own clinic or even your own job in Australia to work as a dentist. So you will be amazing. Life in Australia is like beautiful life. Dr. Leah, is ADC part 2 is difficult or doable? Okay. Dr. Tanvil, I will tell you something. Um, I always say that ADC journey, it's not easy. You need to put effort as anything in this life. But I will tell you something. With consistency, with effort, with hard work, you will do it. It's not something like, impossible. I have many fighters, they became champions and they passed the exam. If you follow up on part 2 page for us, you will find that we have a lot of people passing the exam. So yes, part 2, it's not easy and it's not impossible. You will do it one day. Yes, Dr. Johan. I
Can
was
you
a
guys?
student of Dr. Adam. Hi, Dr. Adam. Yes, we can hear you.
Okay, guys, I'm actually I don't know why it's been dropped. I'm trying now to get the
That's
connection
Dr.
back.
Adam. I stole your candidate. I was talking to them.
Oh, that's okay. As long as you're gonna look after them, that's okay then. Okay.
Okay, I will give you the mic now, Dr. Adam. All the best with your candidate.
Thank you very much. Because do you think like I'm still sharing the screen? The screen has still it's not shared, right?
No, the screen is not shared.
Okay, let me check right now. Okay,
Thank you,
guys, just please,
everyone.
guys, sorry for this. Yes, just guys, give me a few seconds because I'm working on this connection issue. Because I'm using now my phone. But am I still live there on Facebook?
Yes, Dr. Adam, you're still live on Facebook.
Thank you very much for the confirmation. Okay, let me check this. Okay, guys, let me do one thing, please, guys. Give me a
No worries, Dr. Jovan. It's my pleasure to help everyone. And I cannot wait to have you guys, everyone here in part two soon. Yes, you will pass part one, and you will pass part two, and you will be Australian dentist in Australia one day. This dream will happen. And everything after this will change for better. I promise you. So Dr. Tanvir is asking, how's your experience of joining Dr. Biro Academy for ADC Part 2? Okay, Dr. Tanvir, my experience, if I tell you it was amazing and all of these things, you may say because she's working with them now, right? So I will be telling you the truth from my side, and I will tell you something. You can hear as well our fighters or our champions experience on part two page. It's Westmed Dental Academy Team and Gallery. They have amazing reviews there. You can listen from them. And from my side, I can tell you it's fun. I'm managing now Sydney Academy because we have two academies for part two, Sydney and Melbourne. It's for on-site technical. I always tell this to our team. Part two or on-site technical, it should be fun. Fun experience means they should come to us in the academy. They should feel that we are family. We are giving them the information part, and we are giving them as well the support they need because they left everything behind. They came from overseas just for you here. They have no one except you. So we need to take care of these people very well, their support and their technical skills as well. Yeah, sure. I will be sharing with you the link, Dr. Tanvir. Thank you, Dr. Funam.
You're just only
Your voice is not stable, Dr. Adam.
trying to fix the connection. I still hear.
Don't worry, take your time.
Doctor, am I audible?
Yes, you are audible now. Yes,
Okay, that's fine because I'm trying not to share the screen. I'm sharing the screen right now, so
no worries.
hopefully it works.
Take your time. Until you share it, I will be answering the questions from our fighters.
No problem.
Okay,
Thank you very much, Doctor, for this. That's really
no worries. Dr. Fatima, we will not remove this video, but Facebook, it has some rules nowadays. They may remove it from their own. So we will try to not remove it, okay? Okay, thank you, Dr. Martina, for sharing part two link for Dr. Tanvir. Dr. Salma, she's asking how long is the course for part two? Okay, it depends because in part two you have different courses, different branch. You have OSCE, you have communication OSCE, you have skilled OSCE, and you have technical as well. And technical, it has on-site and online. So it depends on the course itself. And you can message us and we will take care of you. Okay? Put the video on Dr. Bidu YouTube. Yes, Dr. Tanvir, we will do this. Yes, we will. The YouTube channel will be active as well. Dr. Ray, she's asking, are the bites, cake, and the diamonds okay to clear the exam? Yes, 100% yes. But I will tell you something. For my experience, I feel like when I read more, I can be more confident. Means if you have time and you have time to read more than this, why not? Right? You will be more confident. So why not? Even you will remember the things more easily. So yes, they are enough for people they don't have time. Maybe after 2 3 months from now, you will find that the academy they are announcing for something called a crash course. This is for the people they don't have time to join from the beginning and they lost the beginning and they need to pass the exam. So we have this course for them and they will pass as well. But I prefer to start from the beginning. I prefer to start slowly and to read more and more. So yes, they are enough because I see Dr. Adam. He was putting a lot of effort to make them for you. Very well organized, covered all of the topics and everything that you may need to look for. I hope I answered everyone's questions, guys. And thank you for attending today. I think Dr. Adam will be back in 1 minute. But I'm still here if you want to ask something. And guys, if you one day came to Australia one day, you are more than welcome to come to our academies just to see the academy and to be part of us one day. Just say hi and go. Dr. Fatima, she's asking, it is a task to remember everything? Okay. You don't need to remember everything at all. And this is
Hey
one
guys,
of
am I
the...
audible again?
Yes, Dr. Adam, you are.
Remember everything at all.
Yes, Dr. Adam, you are audible. So, Dr.
Guys, am I
Fatima?
audible again?
Yes, doctor, you are. So you need to remember everything at all, and this is
Okay,
one
that's
of
a
the
great then. Thank you
mistakes.
very much. Let me share the screen, and then if you see the screen, please let me know, okay?
Yeah, sure, doctor.
Okay, guys, can you see the screen back again?
Yes, Dr. Adam.
Guys, please, guys, if you can hear me back again, let me know, okay? On Facebook, please, guys. Let me check the Facebook again. Guys, am I audible, please, guys? Let me know, please, guys, on Facebook. Maybe I will stop sharing. Let me stop share and stop share and share again. Share again. Yes, okay, that's a great then. I see it. Yes. Perfect. Sorry, guys, let's start. Again, technology is very weird, right? Fantastic. Let me share the screen again. I think it's very shared. Yes. Now, back again. Which of these, the most important, right? Is an X-ray or periodontal chart or to explain the patient? The first thing, which is X-ray. Good. Have you read the classification, guys? Have you read the new classification? Have you seen in the new classification that you need to take an X-ray in the first instance? Please, guys, go and read. We already uploaded to you the new classification. Go and read it. Check it. You will find that taking X-ray, it comes first. Because in clinic, what we do is, in the clinic, we take OPG first to get overall idea, or pre-apical X-ray if it's just localized periodontitis. And then after this, do chart. Why is this? Because when you take an OPG or X-ray, it's going to give you lots of details. And these details, not only for diagnosis, but also to help you during the periodontal chart. Guys, did you get the idea? So do you think we do X-ray only because we need to check the bone resorption only, or severity of pockets, or if there is any lesion around? No. We take X-ray to do this stuff, plus it helps it helps us while we're doing periodontal propin depths and chart. How is this? Do you know sometimes when you look at the teeth, for example, if you have teeth like this, let's make this one bigger. This photo is bigger, right? What happens sometimes when you have a periodontal chart, we start with periodontal chart and then I place my probe here in this area. Do you know what happened? It may give me false reading. How is this? It may score only 3 millimeter. And then I doubt myself, how come? The probe depth in this area, 3 millimeter only. Can you please guys give me one justification? How come in a loose tooth, while you doing periodontal probing, you only get score of 3 millimeter? How this can happen? Because of what? You expect it can be more. It can be 10 millimeter, 9 millimeter. Thank you very much, Dr. Daniel. I love this answer. Please, guys, everyone likes Dr. Daniel Hani. Answer, yes. Because sometimes at this area, you may have subgingival calculus, which is not clear to you. And then you doubt yourself a lot. Now, taking X-ray first, it will help you to find out which area you need to probe it more. Dr. Hani, guys, Dr. Daniel Hani has answered the right way, okay? Let me give him heart. Right? Yes, subgingival calculus. That's why taking X-ray in the beginning, it will be important, helping me to do the chart. Imagine. So which one comes first, guys? Chart first or X-ray first? By the way, what we discuss right now, it is our guidelines in Australia. Okay? Thank you, Dr. Demple. It is X-ray first. So the answer, guys, is X-ray. Chart second. Question 2. Mr. Maru recently received a job promotion and reports grinding his teeth due to stress, along with poor oral hygiene. So now, grinding, oral hygiene, lack of sleep, poorly controlled diabetes. Wow, smoking 10 cigarettes. Ooh, that's too much. This patient really needs for attention. What could be the primary cause or causes of his dental problem, which is severe periodontitis, stage 4 periodontitis? Do you think smoking and plaque, which is the main, or traumatic bite and diabetes, or grinding and diabetes, or plaque and traumatic bite, or plaque and diabetes? D delta, plaque and bite. Perfect, love it. A alpha, you're right, A alpha can be correct. D delta, perfect. D delta, perfect. E echo can be correct. E echo can be correct. B bravo can be correct. E echo can be correct. D delta, Dr. Rana, perfect. Dr. Emil, D delta, perfect. Dr. Daniel, seems like Dr. Daniel is periodontist. He knows very well about periodontal diseases. D delta, perfect. Dr. Harisha, D delta, perfect. Okay. Look at this right now. The question asking about what? What is the key word here? The exam will be the same. You must have the same thoughts in exam. People pass in ADC exam only because of these reasons. Primary causes, primary. The question asked about primary causes. Did you read? Yes, doctor, I read. Did you read the video bites? Yes, doctor. Did you read the articles we give it to you? Yes, doctor. Are you sure? Yes, doctor. Perfect. So now we should answer D delta. Why? Because if you read the stuff, we call smoking different name. We call poorly controlled diabetes different thing, if you remember. If someone of you can tell me how we call them, do we call them primary causes or we tell them something differently? Something starts with M for Mary, O for orphaned, D for delta. Risk, I agree, but which risk? Contributing factor can be right. But I like the right way. I want the right one. No, still not happy. I need the word. Thank you, Dr. Poonam. Everyone like Dr. Poonam. Yes, we call it modifiers. Modifiers. Dr. Daniel, you see, I told you, he is a periodonist. Modifying factors. They are not main or primary causes. Smoking and diabetes, they are modifiers. So any option with smoking and diabetes, exclude them. You have asked me before I start the session, doctor, all the options seems correct. Can you please give us some techniques? I give you lots of techniques right now, right? So now the right answer will be, or actually let's exclude first. That's the Bido technique, right? Let's exclude it. Smoking is a modifier, wrong. Diabetes modifier, wrong. C modifier, diabetes, wrong. Is, you see, only with one concept, you don't need to think too much. Only one concept, you get the right answer. E, diabetes modifier, wrong. Still only two factors. Plaque and traumatic bite. Doctor, plaque is the main reason? Yes, primary cause. And that's why we have a separate classification for period diseases as a plaque-induced periodontitis. What about trauma? Is it cause? Yes. And that's why we have a separate entity. For periodontal disease, we call it as traumatic periodontal diseases. Is this the only thing I can tell? Not only the only thing. What else you can see? Traumatic bite is the main reason. I show you something very important here. Look at this. Guys, dentistry is fun. Love. Just read properly, see properly, you will be perfect. Not hard science at all. Look at this. What do you see here? What about this part? Chipped. This part, a bit chipped. Look at this. Look at the type of the gingival recession. Edge to edge, that's edge to edge bite. And gingival recession mostly has been receded because of trauma. The tooth has moved more labially. The bone, not enough bone. Bone became very thin. Gingival recession has happened. So trauma, how do we know it? Anyway, trauma is the right answer even without all this stuff. Based on only one concept, smoking and diabetes are modifiers, and the trauma can be a cause as a separate entity of periodontitis cases. So in this case, that's right answer. Do you want more confirmation for this? Yes. Look at the chipped tooth. Do you want more information? Yes. Look at this, the gingival recession pattern. Why? Trauma result in this. Trauma will result in tooth movement. Where about the movement will happen? Labially. When the tooth move labially, what can happen to the labial bone? Labial bone will become thin. And when the labial will become thin, will be shortened. When you shorten, the gum will recede. Easy concept. And that's exactly happening in this tooth. I hope now it's clear. Guys, now the right answer is traumatic bite. Perfect. They are smart, Dr. Leah. They're really smart. Devil, okay. Modifiers, yes. Stress is devil. And stress results in trauma. Stress is level. Modifying factor. You know, that's the benefit of the mock exam. The benefit of mock exam, not just only to provide the right answer, is to learn and improve. Dr. Simran says, can you repeat, Dr. Bidu? Yes, I can repeat, no problem at all. The last things, yes. The last thing, there is a gingival recession here. And this type of gingival recession is a characteristic pattern of traumatic bite. This shape, the funnel shape, that shape, right? Like this shape, it's a characteristic gingival recession for trauma. What has happened is trauma on the tooth. Tooth will be shifted buccally or labially. When you keep traumatized the tooth, the bone on the buccal side will be thin. When the bone on the buccal side became thin, it will be reduced in height because become thin, goes down, goes down, goes down, thinner by thinner. When the bone goes in reduced in height, the gum, I discussed this in the last session, gums follow what? I give you an example of if you lose weight and you have a dress, the dress will be loose, right? Good. Will follow the gums. That's why gingival recession will happen. I hope it's clear right now. Guys, again, what we discuss right now, just not just only answer the questions. You're getting right now lots of concepts, up to 100 concepts right now. Believe me, this 100 concept with at least 50 to 100 questions in your exam. You see how easy is the process if you really concentrate and focus? Not hard, but you can make it hard in yourself. You can make it easy in yourself. The answer right now is D delta. Question 3. Answer is easy now, right? We said it's stage 4. So now we're looking for stage 4. The right answer can be B Bravo can be the right answer. D Delta can be the right answer. E Echo can be right answer. Why stage 4? Because it has severe mobility. Mobility grade 3 means means stage 4. Which grade now? Is it grade B? Or grade B again? Seems like B and E, they are, no. Oh, well. This is B is wrong because this is not class 4, that's a class 5. Wow, tricky. You see, I even trick on myself. Imagine I trick myself as well. So now answer either to be D or E. So now is it grade A? So it's grade C or grade B? It's grade C. Why? Patient smokes 10 cigarettes a day. Grade C. Patient has poorly controlled diabetes. Grade C. So now the right answer, D delta. Look at the amount of bone resorption. A lot from the X-ray. So now we are into grade C, stage 4. I'm not quite sure about this one. Not really. Give me guys 1 second, please. Because what I do right now is I will stop sharing for a second because the screen was in front of me. Oh, and I will share again. Let me put this one down again. And then let me go to here. And then share again. Share again. We are now sharing. Okay, so the right answer is D delta. I hope it's clear. Let me check if you have any question for me. Why not grade 5? Because Dr. Martin, there is no grade. Sorry, grade 5? Because there is no grade stage, you mean, right? Because there is no stage 5. It's only 4 stages only. 1, 2, 3, 4. No stage 5. Okay? A stage 4 is regarding this localized area. Yes, doesn't matter. Doesn't matter. Doesn't matter. We don't know about the rest as well, Dr. Teresa. We only focus on this part, but we haven't seen the other things. But we go normally, we actually provide, or actually our stage in our classification to the most serious part of the mouth. Why not stage 3? Because mobility grade 4, severe mobility. Mobility grade 4. If you have a mobility grade 3, sorry, grade 2, grade 3, you say the way to jump into it. Yeah, this will be extracted, doctor. It will be extracted in the future. These teeth will be extracted because they are severely mobile. Okay, can you treat Dr. Daniel severely mobile teeth? Okay, guys, can you please open the classification? Let me just do something for you here right now. Let me do something for you. Again, you'll find this in Beetle Bytes, okay? Let me just do something for you. Station. I'm guys doing something for you right now. That's why it's very important, guys, to when you read, you really need. Okay, guys, can you see my screen right now? Yes? Guys, can you see my screen right now? You're right, Dr. Hen, we cannot, right? Yes. Guys, can you see my screen right now? Our champion. Sleepy heads. Guys, I cannot move until you tell me yes or no, because if you cannot see, I cannot go anywhere. I'm just waiting for you to confirm. What if you cannot see? And then I will explain a lot, and then finally telling me, doctor, we couldn't see the screen. I hope you see. Now, which stage is this? Go ahead, please, guys, answer quickly, please, guys. Which stage is this? Thank you, Dr. Daniel. Stage 4. Perfect. Look in stage 4 what will happen. Guys, read this, please. Can you read this? Perfect. If you have secondary occlusal trauma, which we actually have in this case, plus 2 small degree more than or equal to 2, severely, the word severely, what does it mean, the word severely here? Is that grade 1? Is severely means grade 1? No, severely doesn't mean grade 1. So severely mean is a grade 1, grade 2, grade 3. Does the patient has trauma? Yes, we mentioned this. The patient had trauma, right? Does the patient has mobility more than equal to 2? Yes, because severe mobile. Does patient has more than half of the root resorption? Yes. Look at this. Extended radiographic bone loss extended to middle third of fruit and pain plus we have in this case. Now, guys, is stage 4 is not stage 4? Is it stage 4 or not? Stage 4, right? Everyone, stage 4? Yes, yes. Perfect. I hope now there is no confusion. You see, I told you. The answer is easy if you understand it. Answer is D delta, stage 4, grade C. Grade C was easy. Now, Mr. Morrow, middle-aged man, present, wherever. What is your most likely initial management for this patient? Most likely initial management. Middle age, discomfort, lower front, severely. Perform root planning, explain to the teeth. Explain the teeth. Improve oral hygiene, prescribe painkiller and schedule follow-up visit. Okay. Explain the condition to the patient, do something and refer to the specialist. Do something and refer to specialist. Explain the condition to the patient, not do nothing and refer to specialist. Do nothing, refer the patient. Initial management. Do nothing, refer the patient to the GP for stress management and treat later. Explain that the prognosis is poor and extraction is the better option. What do you think, guys, is the right answer here? Think about it clinically. Think about the staging and the grading and all the stuff. Think about, can you save the teeth or not? Check your right answer. E, perfect. I love this. When I see the right answer, guys, I love it. Think about it clinically, right? Think about it clinically. You have this patient in your practice with poor prognosis.
Dr. Adam, your voice is breaking, doctor. Your voice is breaking.
Too loose.
Dr. Adam,
Because the question asked about patient management.
Hello, everyone. I think Dr. Adam have technical issue and he will join again.
hello everyone.
Let me answer our doctor's questions. For example, Dr. Fatima was saying, it is a task to remember everything. No, it is not a task, doctor. You don't need to remember everything at all. Even this concept is wrong. You need to understand, you need to study things very well. But if you somehow in one day sit and you were telling yourself, I need to remember what was in this task, and you will try to remember everything, this will put a pressure on you, which is not important to happen. Okay? Just study the things well, that in exam you will be able to answer properly. Okay? There is no need as at all in this
So guys,
pressure.
that's exactly what Maru gonna
Dr.
say.
Temple was
Dr.
asking,
Lay, okay? Good. Am I audible now?
hi, Dr. Adam. Doctor, you lost connection and you just back now.
Okay. Thank you, Dr. Lay.
Hello, Dr. Adam.
Guys, am
Yeah,
I audible?
you
Guys, this
just
guys on
back now.
Facebook. Guys, am I audible, guys?
Yes, doctor, you are.
Yes, okay, that's great then. Great. Okay. So now, you tell Maru, that's exactly what I get in Maru. Maru, what actually Maru is, your teeth actually need to go. And then they are too loose. In this case, it's up to Maru. Maru may say, yes, doctor, you're right. May say, no, I meant to see specialists right now. So again, the first thing, guys, you need to do is echo. The rest doesn't make any sense. Question 5. Two years later, and after lunchtime, Mr. Maru returns with a symptomatic periodontal abscess. Asymptomatic, but no severe or systemic feature. Periodontal. He recently underwent joint replacement surgery and is currently on prednisone. What do you think, guys, about corticosteroids? Do you think corticosteroids is immunocompromised drugs medicine or not? Can you treat the patient? The patient. And which condition it is? Treat the deep. Your answer is perfect.
Dr. Adam, your voice is breaking, doctor. No worries, doctors. He will be back again. Okay, no worries. It's just a technical issue. Thank you. No worries, doctors. He will be back again now. Hi, Dr. Simran. No worries at all, doctor. He will be repeating the last question. No worries. Dr. Adam is back now, doctors. Hi, Dr. Adam.
We just do something here. So definitely no extraction today. Extract the affected tooth? No. Drain the pus? No. Drain the pus? No. Do nothing. Prescribe antibiotics. Schedule L extraction. D delta is the best. Why? Why D delta is the best? You are not allowed to do treatment today because of adrenal crisis unless you talk to GP first, treating doctor. 2. If you go into in treatment, the patient may end up with adrenal
Dr.
crisis.
Adam.
3. You need to
There's
prescribe
been Dr. Adam.
antibiotics. Why you need to prescribe
Hello?
antibiotics? 6. Because you will have a delay of 24 hours because of infection there. So D delta is the best. Guys, do you agree that D delta is the best answer? Right?
Dr. Adam, there is no screen.
Okay. I think Zoom should be fine right now. I believe so. I'm not sharing the screen. Let me just make this one bigger. Okay, and then go back. Guys, can you see my screen?
Not yet, doctor.
Guys, can you see my screen now?
Yes, yes, we can see now.
Admit, yes. Okay, guys, so the answer for this question, D delta. Guys, do you agree on this? Not now, yes? Okay, that's good. No screen? Now?
No screen now, Dr. Adam.
Zoom, zoom, zoom. Share. What about now?
Yes, now it's good, yeah.
Guys, can you see screen right now? Now it's black. Don't worry, wherever black will be white one day. Okay? Which one, Dr. Fisher, should I repeat? Tell me which one. Some champions say yes, we can see the screens, and other champions say no, we can't see screens. But that's okay, we can wait. I think Zoom plays around. I think so. Zoom with me plays around. Which one? Question 5? Okay, question 5. I will do question 5 again. Question 4? Question 4? Okay, I will do question 4. This is question 5, right? Let's go question 4. Question 4. Do you agree that these teeth are severely mobile? Can you fix severely mobile teeth, guys? Can you splint them? Can you splint severely mobile? Yeah, I think we'll be fine soon. Okay, things will be fine soon. Guys, can you splint severely mobile teeth? No. Okay, are you going to refer this patient to specialist? Maybe. If this is the first things, the question here, why? You have 2 lower teeth. They need to be extracted. Why then you won't refer the patient to specialist? Why? What's the reason behind this? Okay, doctor, because maybe the other teeth has some issues. That's okay. But is the first, that's the initial management today? No. So special is wrong, special is wrong. Do nothing, refer the patient to GP. Why GP? What does GP will help you? You have to lose teeth down. and the patient cannot bite on them. The patient has pain. And then what is the treatment for these two teeth? Extraction. Exo. Okay, if it's exo. What you need to discuss with the patient, option E, explain that the prognosis is poor and extraction is a better option. Now it's up to the patient. He may say, no, doctor, I still need to do something. Okay, in this case, go to specialist. Is that clear now, guys? Clear now? Yes? Good. Thank you, Dr. Daniel, to say. Dr. Ashika, not every case with stage 4. What if the patient has all the teeth in stage 4 and all of them need for extraction? Are you going to extract the teeth and after this, you refer the patient to periodontist? And then the periodontist tell you, you're really funny dentist. Why? Because you send me a dentulous patient after extract all the teeth. Only because it's stage 4. Right? Okay, doctor, explain question again. Okay. No problem. Guys, which question should I explain? Tell me, question 4, question 5. Question 5, okay, I'll explain question 5 again. Question 4, now it should be okay, because that was question 4. Now let's move to question 5. Question 5. Now, patient has pain. Patient now on corticosteroid, corticosteroid. Guys, am I right? For the last 16 months, right? Easy concept. Corticosteroid plus 2 weeks duration. Let's say, make it this way. Cortisone, 10 milligram cortisone plus 2 weeks duration equal to adrenal crisis. Adrenal crisis is life-threatening condition. When adrenal crisis can happen, if you do the treatment in the same day, under pressure, under stress, without increasing the dosage. Now, can I do scale and clean or incision and drainage to a periodontal abscess to a patient on corticosteroid? No, because you're gonna get a dry crisis. So when should I do this? After we do something called action plan. What is action plan? It's a plan given by the treating doctor or the specialist. And then in this plan, they recommend that the patient should increase the dosage. When should the treatment should be done? Next day. What time? In the morning. Now, the answer. Can you do treatment for this patient today? He's in lunchtime, not morning time. Can you do the treatment for this patient today? The answer is yes or no. What do you think, guys? Guys, please, guys, answer. Otherwise, I will wait here forever, for tomorrow. Forever. No, very good. Dr. Gina mentioned no. So, if it's no, can I just tell the patient, no treatment today, bye-bye, see you tomorrow, or should I do something? Because there is infection, I need to do something. What is this? We need to prescribe antibiotics. And because the patient has pain. So in this case, I need to prescribe what? Painkiller. Which option the right option? D delta. Extract? No. Drain? No. You cannot do treatment today. Drain? No. Do nothing? That's the best. Prescribe antibiotics? Yes. Schedule early extraction? Yes. Early extraction? Yes. Early extraction will be tomorrow, by the way. Tricky case. Question 1. What do you think is the answer for question 1? What is the answer? No problem, Dr. Gilens. Oh, good. What is, guys, the answer for question 1? E echo hormone changes? That can be right, but that's theoretical. It's theoretical, not more practical. E echo, Dr. Preeti, can be. Dosemran B Bravo, I love this. Dr. Anon B Bravo, Dr. Tanvi B Bravo, I love it, guys. Dr. Fishali, perfect. Karma, perfect. B Bravo for you guys. B Bravo, Dr. Leo, always B Bravo, Dr. Leo. Now, the answer is B Bravo. Why B Bravo? Yes, Dr. Daniel, I agree. Why B Bravo? Look at this. We're talking about dental caries right now. Guys, I will teach you, or I actually will discuss with you right now, very, very important concept. Here is a key word. The patient last dental visit was 2 years ago. And the last 2 times, the last time, the patient has better oral health, like no caries. Which condition this patient has been diagnosed recently? Sjogren. So now, the most important medical condition has started recently. At least that was 2 years. And now. So between 2 years and now, the condition has happened. Before 2 years, things would be fine. So sleep apnea, most probably, not the only reason, because even with sleep apnea 3 years ago, you see, guys, the love about this type of questions, about the clinical scenarios, guys, see the love out of it. You see how we think and find the right way we feel happy. Do you think sleep apnea is the main reason why this patient got this type of caries? The answer, it can be one of the contributing factors, but not the main factor. Why? Because this condition only started to happen the last 2 years, but sleep apnea was there in the last 3 years. So which condition could be the main reason? You know what? Sjogren is a condition. Was recently diagnosed with Sjogren. Now, what's wrong with Sjogren and dental caries? Saliva and arthritis. People with Sjogren mostly will get arthritis. What does it mean? They will not be able to brush properly. They think they brush, but they cannot provide proper pressure on the teeth because they mostly have arthritis, chronic arthritis, and saliva will result in caries. Now, hormonal changes. Do you think hormone changes will affect caries or gingiva mold? Do you think people with hormone changes because of pregnancy will get less saliva or more saliva? They will get more saliva. Pregnancy. You know, the pregnant lady will get more saliva and more gingivitis, not caries. That's why hormone change is not the reason. The reason is medical condition, mainly Sjogren. Pregnant ladies get more saliva, not less saliva. So E is wrong, but B is correct. Why? Because the main reason is Sjogren, saliva issue, and arthritis. Sjogren, they have arthritis. That's why they cannot price the teeth properly. Answer is B, bravo. Question 2. You took bite-wing X-ray. By the way, guys, that's a real case. This is a real case from the clinic, okay? This X-ray and the stuff, the real case. You took bite-wing, but definitely with some changes in it for privacy and stuff. You took bite-wing X-ray. What is the most important next step? You took bite-wing X-ray. It's going to be sensibility or percussion or crack. We mentioned this. X-ray, then A alpha sensibility. Love it. Thank you, Dr. Vichali, Dr. Simran, Dr. Gilan, Dr. Asna, and all of you. After we take X-ray, we prefer to do vitality test, then percussion. So the answer is sensibility test. Easy. The rest, it can be done later on, but not the second one. Based on IC-DAS system, what is the most likely carriers classification? I know most of you answered this question wrong. And there is a big surprise here in this question. Big surprise. Thank you, Dr. Simran. You're right. A alpha, C1. Is this the right answer? Guys, it's C1, C2, C3, C3, C4. C1, right? Dr. Kushkan? You will get surprised, guys, with this question. You really get surprised. B bravo. C1. Think about this. Imagine, let's exclude it first. Is it active or inactive? It is active condition. How did I know it's active? Two reasons that has helped me to know it's active. One, because it's between the teeth, and there's no any intervention has happened. So now it is active. No fluoride has been prescribed, no restoration has been prescribed, no enhancement for hygiene not prescribed, so now it's still active. What else made me think it's active? There is a keyword here. Do you know what's the keyword? I tell you. Definitely bad oral hygiene. But there is a better keyword. Bleeding improper. Love, look at this. There is bleeding proper. What does it mean? There is gingivitis in this area. What does it mean? Bleeding problem at the mesial surface here. What does it mean? Plaque and calculus still there. Active condition happening. So now, do you agree? It is active condition from these two reasons. Guys, please, reading is important, this part. So, saying this, exclude B bravo, not B. Exclude D delta, not D, because it's active. Now between A, C, and E. Doctor, still, I'm confused. Is it A, C, or E? Do you know what's the right answer? Big surprise. Answer is E, C4, active lesion. Really? Yes, I told you this is a real clinical case. I made it by myself. I know it. I drilled inside it. Imagine. Look at this. Imagine. Sorry, guys, give me 1 second. Let me just check something here. Whereabouts? Stop this one. Yeah, sorry guys, answer C. C3 active, not C4, C3. Look at this. Where about the carries? No, look guys at the X-ray, sorry. C4, look at this. Do you think the carries has, I will always two different colors. C4 guys answer. Do you think the carries just stopped here? Let me do one line. Just stop at this level, which is the anterior junction. Just bend the anterior junction or the blue line, which is indented. Look guys at the black area. I will remove this again and check it again nicely. Can you see this black area? By the way, guys, I drilled by myself in this tooth. The caries actually starts from here all the way from here, both together. Stage, sorry guys, it is class 4. Think of, just imagine. Tricky, right? Look at it again, you will find it. It is class 4. Active. Sorry, C4 active, code 4 active. Let me check. Yes, the blue line, right? This is a good hint for you. Yes, I think Dr. Bonak, yes. Okay, that's a good hint for you. You need to look nice in the X-ray, guys, please. Dr. Hani, I may need to do a separate session because it takes at least 1 to 2 hours to do this ICD as Dr. Daniel, okay? I can do, if you like, we can do it next time, okay? Because it takes time. So it's actually more than 1/3 of dentin. So it is EX. What is the most significant single factor for considering when deciding restoration, guys? Easy, cavitation, right? No cavity, no restoration. Doctor, but size is important. Depends, but cavitation is most important. Why? Because if it's small size and cavitated, I will restore it. But if it is small size, not cavitated, I will not restore. So cavitation more important than size. Active lesion. It is active lesion, but cavitated. You restore it. Active lesion, but not cavitated. Remineralize it. Location of caries, same thing. Cavitation is the most important. Open contact doesn't make that much sense. D delta cavitation, right? Perfect, guys. Easy. You see, when you know the information in the right way, you can answer. Based on the bite wing X-ray and the information provided, what is your recommended treatment for tooth number 16? C4. C4 and active and hidden. Patient has lots of complicated medical history, includes Sjogren syndrome, not enough saliva. He has high caries already. I don't think in this case I will take the risk to remineralize it. I don't think at all I will take the risk to mineralize C4 because sometimes we may remineralize C4 sometimes. But this patient with Sjogren syndrome, sleep apnea, and all this stuff, really will not be a good decision. We need to restore it. So the answer is restore. C4 sometimes can be restored. Sorry, C4 sometimes can be remineralized. But in this highly risk patient with no saliva, patient cannot brush, don't rely on remineralization that much. However, you still definitely give them high fluoride, toothpaste, varnish, mouth rinses sometimes. You may need even to ask them to change to electric toothpaste and other things. But restore the tooth, please. Oh, this beautiful lady with a face, swollen face. So guys, the previous question answer is C. Now, this beautiful lady. Hi, now, what is answer? What is the most likely diagnosis? Can you repeat? Yes. This question, if you want to repeat this question, the answer is C, Charlie. You need to do restoration. Why need to do restoration? Because it's a big cavity class. It is code 4. Code 4. Code 4 means you need to restoration. Sometimes we can remineralize code 4. But when you remineralize, if the patient is good health, but the patient has low saliva, because salbutamol, the patient is on HELA, low saliva again, and then the patient may have arthritis as well because of Sjogren's syndrome. All this stuff, you cannot rely on remineralization, but rely on restoration. Guys, what's guys' diagnosis of this condition? Is it localized infection? No, definitely. You have a big swelling on the face. How can that be localized? The spreading infection, yes. But which one? Is it severe or with severe feature or without severe feature? Cellulitis, by the way, guys, not a diagnosis its own, by the way. It is somehow, cellulitis is not a diagnosis. Cellulitis is a sign somehow. Cellulitis is a sign. Cellulitis can happen in even an insect bite. Insect bite, it can result in cellulitis. Cellulitis can happen in infection cases, either severe feature or without severe feature. You can have cellulitis. So now B and C. Do you think the severe feature or without severe feature? Severe feature, you have elevation of temperature. Do you have any elevation of temperature more than 38? No. So far, without severe feature. Do you have a raised tongue? No. Do you have suffocation? No. Do you have difficulty swallowing? No. Do you have difficulty breathing? No. So why then should be severe feature? It is not severe feature. Why? Look at the face. Do you think this swelling has closed the eyes? No. So now we're talking about be brave. Tricky. Guys, did you get the point so far?
Hello, everyone. Seems like I will be talking a lot in this session. This is Dr. Leah again. Dr. Adam will be back again soon, okay? You can have somehow a drink water or something for 1 minute and he will be back now. Thank you. I see you doing great. Most of you answering right. And even if you answered wrong, it's good as well. At least you are trying. I'm very proud of you guys. To get out from the bed and to try and to practice and to be again in this field, it's not something easy. So I'm really proud of you. I think Dr. Adam is back again now.
Guys,
Yes, doctor, we can hear you now.
so now, answer, right? Now, back again, guys, to this question. Prescribe prophylactic antibiotics extracted tooth immediately. That can be right answer. Refer the patient to the hospital. No, because it's not severe. Prescribe antibiotic and ask the patient to return after a week. Wrong, that's the way. Check the patient's blood pressure. Wrong, doesn't make any sense. Contact the treating doctor to discuss warfarin management. No need to warfarin management. Do you know why? Because warfarin is already managed. 2.2 means like warfarin is already managed. You don't need to talk to GP anymore. GP will tell you what else you want. It's only 2.2. Why do you ask about it? So the right answer now, guys, is A alpha. What do you think, guys? The answer for the next question. By the way, this patient has severe pain. Which one of these will work in the severe pain? Guys, what's the answer to this question now? Question 3. With severe pain. A alpha? Yes, perfect. Beta bites, right? Paracetamol, oxycodone. Why is this? Because severe pain, I need a strong painkiller. Oxycodone is a strong painkiller. She's on warfarin. Oh, look at this. She's on warfarin. Can I prescribe niacid with warfarin? No. Any option with non-inflammatory, non-steroidal, anti-inflammatory drugs like ibuprofen or aspirin shouldn't be taken in this patient. Any option with ibuprofen or aspirin should be removed. B is wrong because it has ibuprofen. C is wrong because it has aspirin. Codeine, we don't use it anymore. We don't use it anymore. Paracetamol only will not be enough, but A alpha paracetamol and oxycodone is the best. Strong painkiller and safe. Question 4. After 1 week, the patient shows minimal improvement. What you do next? Extract now, please. Please extract now. You already provided antibiotics which didn't work. Enough. You killed the patient. So what is the right answer? Be bravo. Repeat question 2. I repeat question 2 too again. No problem. What is the most appropriate step? Extraction. Prescribe prophylactic antibiotics and extract. Why? Someone may ask me, why, doctor, prophylactic antibiotics? Because the patient has prostatic heart valve. That's why we need to prescribe prophylactic antibiotics. And then extract immediately. Why, doctor? Because the patient has infection. Even if the patient has poorly diabetes, still we need to extract. That's even a better reason. That says a good reason to extract, because diabetes means if you don't extract, the patient will be immunocompromised, and then the tooth will not, and then the body will not be able to handle the infection, which is the tooth. Answer is A alpha, please, in this one, okay? Next question, A alpha. Yes. After 1 week, the patient shows minimal improvement. Are you going to prescribe again antibiotics for extracting now? Enough, right? Enough antibiotics. Be good dentist. Be bravo. Enough antibiotics. No, Dr. Ryan, I mentioned this before. No. Guys, what is your answer? I know now why, guys. Some of you don't score good. I know why. Why? You really, guys, you need to improve you really need to improve, you need to read, and you really need to improve, guys, your critical thinking. Guys, you should have extract these tools from the first visit. So answer is B, bravo, guys, okay? Question 5. What do you think, guys? Answer question 5. Dr. Lay, always like this. Question 2, we did extraction? No, you didn't extraction. Question 2 is asking you what is the best to do. Question 2 is asking you. Read the question properly, please, doctor. What the question asks, what is the most appropriate step you should take today? The proper is to do A, but what has happened is dentist didn't do the right thing. Dentist did something wrong. You decided to prescribe antibiotic and plan to extraction later. Read the questions properly. So the right thing is A, but the dentist didn't do it. Dentist did something wrong. Now, question 4. Did you get it? Read. Dr. Marina. Okay? Dentist didn't do extraction. Dentist provided and they said, we don't do extraction later on. Proceed with extraction, guys. Be bravo. Question 5. After extraction and completion of antibiotics, the infection still hasn't resolved. What is your next step? You ready the extraction now. What will you do? C, Dr. Vishali? Maybe. B, Dr. Amalia? Maybe. Dr. Tanvir? C? Dr. Sahil, be bravo. Dr. Jilan, be bravo. Dr. Lay, always be. Okay, Dr. Mariana. No problem, Dr. Mariana. Dr. Kilvenda, be bravo. Dr. Simran, refer. Let me check. After extraction, completion of antibiotics, the infection still hasn't resolved. What do you need to do? Be bravo, please, guys. You perfect, guys. Thank you. I'm happy with this answer. Yes, perform culture and sensitivity test. That's true. You need to know what's the reason, what's going on. Histological is the best. Be bravo. Perfect, guys. This question is wow scenario. This scenario. I believe, dentists, I know all of you smart. I know this, I'm sure about it. But I'm sure to answer this question, you must be very, 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 very smart. Like this scenario, the whole scenario. We actually explained this in Bidu Bytes, and this photo being taken from the Bidu Bytes. And it has the proper class in it in the Bidu Bytes. Based on the basic periodontal examination system. What is the score of tooth number 2-1? Face tooth. Bidu Bytes. Cakes and diamonds. B bravo? D, Dr. Lay said D delta. Dr. Valija, B bravo. Dr. Kelvenda, D delta. Yes, Dr. Daniel, I believe both together, Bidu Bytes and cakes in the same folder. D delta, Dr. Daniel. Very good, Dr. Daniel. B bravo, Dr. Tanvir. Let me check. Now, imagine if you want to complete this proof, how does it look like? It will look like this. Let's make it with white color. Okay? The proof will look like this. Do you guys agree on this? Why? You will find the ball here. Let's make it with green color. Very small ball. How big is this ball? 0.5 millimeter. So far, we have 0.5 millimeter inside the gum. What else? You will find the black part, which is white part, which is another 2 millimeter. The white is 2, and then black part will be another 3 millimeter inside the gums. That's why the black part not showing, because the black part inside the gums. Now count how many millimeter inside the gums. The green is 0.5 millimeter. Plus 2 white, 2 millimeter, which is this one. This one inside. Plus 2 millimeter. Plus 3 millimeter. This one. From here to there. In total, how many millimeter, guys, inside the gums? 5.5 millimeter gums. If you have 5.5 millimeter inside the gums, which score it is? Score 4. Thank you. Based on the BPE score of tooth number 2-1, what is the most appropriate management? Easy now. If it's 5.5, what you need to do? You need to do scaling, you need to do route planning, you need to have a full periodontal examination, and you consider referral to specialist. Why? Because most probably you end up with severe condition. Answer is Dr. Eshika mentioned, Dr. Walija, or Dr. Simran mentioned, but the black band is visible. Do you think only black band in this probe, Dr. Eshika? In this probe, only one black band? Let's check this. Do you think so, Dr. Eshika? Like, do you think this probe only 5.5 only? Or it should be 11 to 12 millimeter probe? What do you think, Dr. Eshika? Thank you. It has two black bands, not only one black band. What black band inside the gums? And the other black band is outside the gums. Easy now, Dr. Eshika? Thank you, guys. Very good. I'm very happy, guys, to know this. Now, E equals the right answer for periodontal examination. Again, straightforward. Again, as I said, this scenario really need you guys be very, very attentive and your eyes big like this, okay? After completing the clinical examination, the general dentist asked you, which of the following findings may not necessarily present as periodontitis? A true pocket depth more than 3 millimeters is the answer. Or apical migration, the question, guys, ask about what? Be careful. The question ask about may not necessarily. There is one finding, so from A to E will not be necessarily. Existing in periodontitis cases. D delta. Thank you very much, guys. Bleeding gums. Perfect. Not every time bleeding gums should be existing, but inflammatory process, yes, because periodontitis on its own, it is inflammatory process. There is no inflammation, no periodontitis. Pocket depth of more than millimeter, yes. If there is no pocket depth more than 3 millimeter, no periodontitis. Apical migration of epithelial attachment, yes. Because if there is no apical migration of epithelial attachment, there is no loss of clinical attachment, no periodontitis. So, but the only one bleeding gums not need to be existent in every single periodontitis cases, especially in a smoker patient. They are smoker. Normally, their gum does not bleed. So answer D delta. Another good question. Another very smart question, very tricky. Given the maximum pocket depth is 5 millimeter, this part here, we're talking about this part. Here, I'm talking here. From here, okay, the pocket depth, sorry. Pocket depth will be 5 millimeters, so all the way from here to there. The maximum pocket depth is 5 millimeter, which is here. Right? Now you have 5 millimeter pocket depth. Will be able to calculate the attachment loss or not? E echo cannot. Dr. Alifea cannot. Dr. Koshkan cannot. Dr. Valija cannot. Dr. Leo cannot. Dr. Saifa cannot. You see, I told you. Dr. Daniel cannot. It is asking approximate. I love it. So could be B, could be D. I love it, Dr. Shiva. Please, guys, everyone likes Dr. Shiva. Big heart for you. Dr. Amolia, big heart for you. I love, guys, when you get the answer to this question. Dr. Shiva mentioned approximate. I love it. Okay, let's, guys, discuss this in details right now. Imagine the answer is D delta. Smart. D delta. How D delta? Can you give me, guys, please, the formula to calculate the attachment loss? The question asks about what? The approximate attachment loss. Approximate. Look at this. Roughly. So, guys, what is the formula for attachment loss? Very good. Attachment loss equal to periodontal pocket depth plus gingival recession. Gingival recession, right? Let's calculate it right now. Do you remember mathematics in school, guys? Do you remember that? Do you remember mathematics? How big? Okay, let's now compensate in this formula. The formula mentioned that clinical attachment loss equal to pocket depth plus gingival recession. So cal equal to, do we have a pocket depth? How much pocket depth? Guys, how much pocket depth, please? Five. Thank you very much. Let's put 5. Oh. 5 plus gingival recession. Do we have gingival recession here? Here's a tricky part. We're talking about the middle buccal. We're talking about this area. Let's make it green color. We're talking about this area. Do we have gingival recession? Can we get the gingival recession by any way? Yes, we can get it. Thank you, Dr. Adam. How much, guys, do you expect gingival recession in this case? Minimum. How much minimum do you expect? Is it 1 millimeter, 2 millimeter, 3 millimeter, 4 millimeter, 5 millimeter? What do you expect? Okay. Clinically, guys, this is all about your exam. ADC exam is only about this, believe me. ADC exam is about this only. Where about, if I put a line here, let's draw a line. Do you know the gums should start at cement to enamel junction? The cement to enamel junction of this tooth, I would say until here. This is cervical. That's the cervical part of the tooth. Do you guys agree on this? That's the cervical part? It may make it red in color, blue in color. Do you agree that this is the cervical? Now, this green line, how big it is? Is it 1 millimeter, 2 millimeter, 3 millimeter, 4 millimeter, 5 millimeter, 6 millimeter, 7 millimeter? How many millimeter this green line from the blue until all the way under the gum? How many millimeter? 4, 5, 6 millimeter? Now let's compensate. Let's now put down 5 millimeter or 4 millimeter, whatever. This is approximate. 4, 5 millimeter. So now we're talking about cal out of 9 to 10 to 11 millimeter. Now, guys, if I give you the same information in the future, or you have this patient in the future, because guys, what you do in the clinic, how do you calculate the gingival recession in the clinic? Ask yourself, how did you calculate gingival recession in the clinic last time? From where to where? From cement to enamel junction to what? The gingival crest. So what I did only is I calculate the gingival recession by myself. I didn't wait to ADC to give it to me. I didn't wait to get a chart. Now we need to check, guys, in Australia. Are you able to calculate gingival recession by yourself or not? Guys, am I clear so far? Is that clear, guys, how to pass this exam? What really you need to pass this exam or not? It's not Dr. Walija. It's not assumption, Dr. Walija. It's calculation. I didn't assume. I just calculated the approximate. The approximate, Dr. Walija. Did you get this? Did I? Okay, let me just share this again. Dr. Walija, did I assume the truth? Did we assume anything? We didn't assume. It's calculation. Do you agree that cement to enamel junction is here? It's gonna be an issue if you don't know where is cement to enamel junction. It will be really hard if you don't know where about does the gum has stopped. Now you just only by this calculation, do you think that's 1 millimeter? Do you think that's 2 millimeter? This is more than mid of the root or not? Yes, more than half of the root, like 2/3. As a dentist, we need to know the root, it's about 10 to 11 millimeter, the root itself. Now I have 2/3. Means about we're talking about like what? About 1/3, 2/3. More than 3 millimeter, more than 4 millimeter. So now we're talking about 9. It's not assumption, it's calculation now. Clear right now, Dr. Walisha? It's calculation. It's approximate. It's called approximate calculation. Okay. Guys, clear now, guys, to you? Is everything clear right now? Dr. Kushkan, I already repeat again. Do you want to repeat again? Because I know there is delay in the stuff, right? It is not to the base of the pocket. Who said the base of the pocket, doctor? I didn't measure to the base of the pocket. We measured to the gingival crest, the top part of the gum, doctor. Clinical attachment is the base of the pocket. From cemento enamel junction to the base of the pocket, clinical attachment. I didn't calculate, okay? Did you get it right now? Gingival margin is here. Guys, gingival margin is here. Look at this. This is a gingival margin. It's here. Look at this. It's here. Guys, this is a gingival margin. This is a gingival margin. That's a gingival margin. And this is a gingival margin. Clear? I know, guys. Please, guys, go and read. Once you can, maybe you can listen this again, okay? You can listen this again, and you will understand. Again, cal equal to pocket depth plus gingival recession. Gingival recession, okay, I will do everyone on details. You know what? I will give you different calculation, guys, to know it. Cal equal to pocket depth plus gingival recession. You know what? Different calculation. Cal equal to cemento enamel junction, distance from cemento enamel junction to pocket depth, or gingival sulcus, or the sulcus of pocket. That's a Cal. What is periodontal pocket? Periodontal pocket, periodontal, okay, equal to periodontal pocket, right? Yes, periodontal pocket depth equal to gingival crest to the gingival sulcus, like this one. Okay, what about gingival recession? Gingival recession will be from cemento enamel junction to the gingival crest. That's it. You know what? Listen this in the recording and then calculate this way, you will understand. Now, do you wanna do this one again? I will do for you. Let's start with scale. What is scale? Scale from cemento enamel junction. That's here, this point. We're gonna make it red. That's a cemento enamel junction, let's say, all the way to the pocket depth. Where about the pocket depth? 5 millimeter from here, somewhere here. Now, I have 5 millimeter plus, right? Cemento enamel junction until here, which is the mid root. Maybe this about another 5 millimeter or 6 millimeter. So now we're talking about maybe 9 to 11 Cal attachment loss, right? Which is approximate 9 as approximate. Now, that is this is the stuff. Now, what about gingival recession from cemento enamel junction to this pocket, or like this one here? Otherwise, someone tell me, doctor, why are you talking about this tooth, no tattoos, for example? Okay. Now, so now this is gingival recession. Gingival recession, cemento enamel junction to the free gum, like here. How much this one? About mid root or something. So we're talking about 4 to 5 millimeter. That's a gingival recession. Pocket depth, we said from the gum, free gum, or the gingival crest, all the way to the pocket depth, which has a 5 millimeter. And then all together, attachment loss. This plus this attachment loss. I hope now it's clear. Guys, is it clear right now? Hopefully no confusion. Hopefully no confusion. Yes, D, guys, D. I only want you guys to have a clinical thinking, guys. Yes, D, yes, D, yes, D, yes, D, yes. D. So the answer is D. This is a max I can see. If there is maybe 10 to 11, we may think about it. But do you think cannot be assigned? No, it can be assigned. Now, how easy now. Don't tell me again cannot be assigned, please. Please don't tell me cannot be assigned. What is the answer here, guys? Question 5, what's answer? I'm happy that you knew about what sort of question you did wrong. And what was the wrong part of it? Why did wrong? Most probably, guys, because again, because the clinical judgment and critical thinking, you don't have the proper concepts behind it. You have read, and you thought reading only will be enough. You didn't apply the critical thinking part and the system. Thank you. If you answer D delta, I'm happy. Do you think D or C? Let me read again. Teacher, poorly controlled, wishes to save front teeth, improve their appearance. Peristaltic raising cake, examination review, generalized periodontism, deep pocket temporal regime, patient reports my discomfort and joint. Only. Only. It can be stage 3, it can be stage 4. Guys, by the way, how was the mock? So far, after we go through all these concepts, however, I knew you read TG, I knew you may have read bites, I knew all this stuff. What do you think, guys? What do you think about the mock now? After we discuss this question, the one you thought it's really hard, or maybe it's very easy, but finally you end up with only 50 or 60%, which is still good, not bad at all at the initial stage. No mobility mentioned or very good. I love this. No mobility mentioned or drifting. I love it. I think the mock is getting easier. Yes. I think the mock is getting easier. Thanks a lot to Daniel saying this. I hope next time I'm more ready. I'm very happy to do this. Yes, guys, you must have this tricky. Yes, it's Dr. Vijali. The exam will be tricky as well, by the way. That's why we need you to answer these tricky questions. We learn you, sorry, we teach you, we train you on the trick questions, because exam will be tricky. The only people gonna pass the exam, the people really, the champions, they really know how to answer trick questions. No mobility mentioned or drifting, I agree. Okay, guys, what do you think the answer here? Is it 3 or 4? There is no drifting, right? There is no drifting. There is bone resorption, but bone resorption only will not be enough. So guys, it's stage 3. Stage 3. 3, guys. 3. Mild mobile. Let me check. Very smart. If you got the point, mild mobile. Yes, thank you. Perfect. Mild mobility. It means stage 3 because it's a mild. It's not severe. It can be saved. It can be treated, for example, by grafting, by surgery, by anything. So guys, it's 3, okay? No problem, Dr. Daniel. That was very good. I was very happy with your answer. Guys, again, guys, what do you think? Where about Dr. Masticator dysfunction? For about to get this masticator dysfunction? I don't think. When would you like, guys, would you like similar mock or different mock? Final question, Dr. So in Australia, we can extract tooth even if there is an you should. If you don't extract it, Dr. Jovel will be in trouble. You should extract it. Guys, what do you think? We're gonna do another mock, right? Do you want to do the other mock the same way, different way? And do you want me to change something in this mock? Same way? Okay, I will do same way. Same way, okay, Dr. Rand. I will do same way. Okay, I will do Dr. Simran same. Different way, okay, Dr. Fatima. Let me please tell me about your suggestion, please, Dr. Fatima, okay? Same, okay, was difficult, but after was difficult, but after session, it's easy. I'm very happy, Dr. Haish, to hear this from you. Are not we supposed to do the mock and the drive first too? No, the drive will be tomorrow. Our mock is in tomorrow, and sorry, Monday. Our private mock on Monday, right, Dr. Teresa? Because no, actually, it will be Wednesday. Tomorrow will be on Monday, but our private mock will be on Wednesday. That's always happening. And we already did the mock, I think, for the prestige, Dr. Teresa. On Wednesday, we did it first, yes. Dr. Daniel, learning thoroughly and taking point by point suits my studying style. I love this. That's what exactly I love to hear from the champions. When you guys take your life slowly. I study the points and memorize them. So next time, you're very smart, Dr. Daniel. I know what was about that point that I missed. Perfect. We won't see your result, Dr. Bidu. I'm not quite sure you're gonna happen or not, but let's see. Okay. That's very good, guys. Reading your comments really making me really very happy. You know what? I'm now very optimistic, guys. I'm now very optimistic. Let's check now the results. Wow, that's good. I scored 100%. See, guys, 100% right. No wrong answers. No skipped question. 100% right. Okay, doctor, we're gonna make a poll for Saturday. Dr. Sanjita, this discussion helped to read the question in answerable way, the key points, and to notice the important points. Thank you, Dr. Bido. Thank you, Dr. Sanjita, very much. Tomorrow mock? No, Dr. Gillian, not tomorrow. Dr. Ashika, questions so tricky, but after listening your explanation, feeling like why I was doing the mistakes. I love this, Dr. Ashika, because you know what? Once you write down, so next time, I believe you never get the same mistakes you did like you did before. Dr. Fatima said change to more trick questions. Oh my God. You're very good, Dr. Fatima. You're really very good. I thought you said make it different to make it easier. But you said make it different because you want to make it more tricky. Wow. Good on you, Dr. Fatima. Wednesday, okay, Dr. Simran, no problem. I mean, the Restige task to mock present in the drive. It is existing, Dr. Teresa, it's there. We will do a poll, Dr. Tanvir. Yep, no problem, Dr. Teresa, we do mock. Dr. Anshi, Dr. Ashnit. It was correct, Dr. Biko, Dr. Bidu. But feeling better after this session. I'm very happy, Dr. Ashnit, for saying this. Thank you very much, Dr. Ashnit. Thank you, Dr. Ann. Dr. Gilan, can I know how many mocks do we have per week? Okay. You have in the drive itself, you will have 2 mocks. And then on the Telegram, we do regular mocks in Telegram always. Like you have maybe 2 or 3. That's it per day. And then this Alpha Genius, so this Alpha mock, at this stage, 1 every week. And then Alpha Genius will be 1 every week as well. And then the Alpha mock archive will be a lot of them. Once we finish, you're gonna have like 2 or 3. You see, Dr. Adam, happy for me. Congratulations, thank you. Dates, and then we'll do the public. If there is private mock to be done for this Monday we have sessions, yes. But you can answer the private mock if you want. But we'll have sessions, we're gonna talk about, we're gonna explain more topics and more concepts. Everyone clap for me. Thank you, guys. I'm clapping to you too, Dr. Hash, and every one of you. Need to focus on keywords. Perfect. That's the right way, Dr. Kushi. Dr. Kushikan. It was nice, Mock. Thank you very much, Dr. Kushikan. We're going to add all this mock for you in the mock archive. Hi, Dr. Ntiji, there was a part written that's antibiotic don't work when patient comes back for review, X-ray or CBC can take to see if the past trained adequately and modify. Yes, but before this, Dr. Kelvin, because that's true. We agree these options are true. But before this, culture test is important. Please go and check on the word culture and sensitivity test, and you will find if treatment will not work and then the antibiotic will not work. In this case, don't repeat antibiotics, but you need to do culture test. Dr. Anno, I have learned from this mock. The way you told everyone trick is always look at the keywords. Yes, Dr. Anno, I believe in this. You're totally right. Always look at the red flags. Perfect. Green flags if there are pictures. You see, you know what? You have actually, Doctor, I love this, Dr. Simra, Dr. Anam. Let me give you a big heart. You have summarized what we did right now in this sentence. Yes. Keywords very important. Looking at red flags very important. Look at the pictures, X-ray very important. Critical thinking very important. You must wear a loop when you check X-ray. Perfect. I love this. Believe me, if everyone has done this, you should have scored above 90. Again, not about reading only. Dr. Bido, in okay, scoring, we use WHO proof. Yes, for scoring. That has black band. Yes, one black, no, two black bands. Not only one, two, because it's long. It's about 11, 12 millimeter long. One only black, it's only 3 millimeter. That would be too short. That would be dwarf, right? No, it's two. No, Dr. Simran. Only one black is no, because it will be too short to prove. Not, no, right, it's two. Okay, please, Dr. Simran. Go and have a look to it, please. Okay. It will be uploaded, Dr. Jaylan, in the app. It will be uploaded in the app, Dr. Jaylan. I would like to see how is your dashboard look like. Like this, doctor. This, 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 this. I don't know why this one open now. This, this, this. That's my dashboard. But why? Are you interested in teaching, doctor? Why would you like to see my dashboard? I can share the screen for you then if you want, which is all this only. Okay, guys, I'm very happy. I was very happy having all of you here today. Okay, thank you very much. See you then next in the book. Okay. Same run. It's two bands, it's two black bands, at least two black bands. Okay. The HW, the CIT, and the same things is open with the bytes with all these to Simran. Okay, those Simran, you will find them all of them there, please. Okay. Very much happy having. I think we have about 3 hours of session. Imagine this. 3 hours and a half, right? Okay, guys. So I was very happy, guys, to have all of you here. I see you one of your days.